Hi, everyone. I am so excited for today's conversation with Rashida Manuel Fuller, the VP of Diversity, Equity, and Inclusion for Planned Parenthood of Southwestern Ohio. Rashida is doing incredible work in reproductive health, education, and advocacy, ensuring that women and girls have access to care, knowledge, and the resources that they need in order to make informed decisions about their bodies and futures. Rashida, thank you so much for being here. And before we dive in, can you introduce yourself and share a little bit about your role at Planned Parenthood?
Sure. Hi, everyone. I'm Rashida Manuel Fuller. I use she, her pronouns. I am the VP of Diversity, Equity, and Inclusion at Planned Parenthood Southwest Ohio. And I've been in this role for about 3 years now. I am the first VP of DEI. We have not This is a new body of work for us. So it's exciting to be able to build something from the bottom up that impacts our organization and our patients. I'm really excited about our health equity work, which is looking at how do we center the voices of Black women and girls and gender expansive people in our care delivery so that we can provide the best quality care for folks like us. So I'm really excited about that.
Thank you. So we know that access to reproductive health care is such a huge issue, especially for Black women and girls. What are some of the biggest barriers you see in your work when it comes to Black girls getting the reproductive care and education that they need?
Well, I think that here in Ohio, there are several. First of all, Ohio doesn't require schools to provide medically accurate or comprehensive sex ed, which means that there's no standard curriculum for students and the information can be wrong. So Black girls aren't getting the education about their bodies, about sex, relationships, and other information that's absolutely vital to their health and well-being. Another thing is that Black girls are coming up in a society with less rights than their mothers and their grandmothers had. So, thankfully, here in Ohio, our voters passed an amendment a couple years back that protects abortion access. But for many girls in the surrounding states, that's not a readily accessible option. So you have a society where girls aren't getting the education that they need about sex and relationships and pregnancy. And then they have limited or, in some cases, no access to needed healthcare like birth control and abortion. And so, on top of all of that, the US is the worst country in the developed world when it comes to maternal and infant mortality. So, you can kind of see how there's a trickle down effect there where you don't have the education you need, don't have access, and then you have those really scary outcomes.
Yeah, you actually hit on something that transitions us to our next question because we are in like this technological revolution and there's so much access to information via social media.
Mhm.
We have phones that now act as computers. And so thinking about the stigma and misinformation around reproductive health, how does that impact the way that Black girls and young women engage with healthcare providers or sometimes avoid care altogether?
Yeah, I mean, I think that there's several issues. If the girls aren't getting the education that they need that is reliable and medically accurate in their schools or in other community settings, then they don't even know what questions to ask when it comes to advocating for themselves with their healthcare provider. And then on top of that, they're getting all kinds of information on social media. And, you can look at the stuff that's out there and it might look like it's real. It might look like it's, Dr. So and so said this and I can trust it. And you can't. So you don't know who Dr. So and so really is. And there's all kinds of wrong information that's out there. And so you're not getting accurate education. And then you're getting bad education or bad information on social media. So that's kind of a recipe for a disaster. So when you go into the healthcare system and you're talking to your provider, you don't necessarily feel, you might think that you already got all the answers because you heard from, whoever on TikTok, and that is not accurate information. So you don't know the questions to ask. And then on top of that, there's the stigma that comes along with the way our society treats sex and treats our bodies, our reproductive health care. And so if you have that stigma and that shame around talking about it, then you're really going to feel that in a healthcare environment, in a setting where you have this doctor and you're supposed to be speaking up for yourself and you're young and maybe you feel a little uncomfortable. So it's a lot easier to rely on the information that you might find on social media and not rely on the accurate information that your doctor can provide you.
Thank you so much for that. I think about, all that you said, and then thinking about like how we can shift to solutions. And so, from your perspective, what gaps do you still believe exist when it comes to ensuring that Black girls still have access to culturally relevant healthcare education that's also comprehensive? Because we all know that reproductive health is still impacted by our mental health, and thinking about even the political climate that we're in, just the policies. And so, yeah, from your perspective, what gaps do you think still exist?
Well, there's a lot of gaps that already exist, and then there's even more gaps that are being created right now. So, but I think some of the gaps that do exist, as you mentioned it early on, is that culturally relevant care. So our providers aren't being taught culturally relevant care. They're not being taught to trust Black women and gender expansive people, to know their own bodies and to believe what they're saying and what they're telling you. You know, we've heard the reports of, doctors being told that are taught that Black people don't experience pain in the same way that white people do. And so you have myths like this being proliferated through our medical care system. And then those people are then providing care to us. So that that creates a huge gap because they aren't even able to provide the basic care that you need. That starts at the basis of any relationship is trust. And if you can't trust what I'm saying, then how can I trust what you're saying to me? So I think that's one gap. I think the education piece I mentioned is another gap because there are so many. We see patients who come in and they don't know basic information about their bodies, about even pregnancy or how pregnancy happens, or sexually transmitted infections. They aren't aware about those, and so that education that you didn't get as a kid, where else are you going to get it as you get older? There aren't those other platforms or environments for learning. And so that creates another gap that, there's care that people, they're able to access or even talk about because they're not getting the education that they need. So I think those are just a couple of gaps that I see. And I think maybe another one would be just when it comes to trust. I mentioned how trust is kind of vital for relationships. Well, doctors aren't trusting patients, right? About, trusting Black women. We say that a lot. My shirt says stand with Black women. Our doctors aren't necessarily standing with us in the way that they should. But on the other hand, we have a whole history of racism and mistreatment in the healthcare system. And so we go into the healthcare provider and we already are feeling mistrust. And so that creates that relationship where the doctor or the provider isn't trusting you, you're not trusting the provider, and it's not going to lead to the best outcomes.
Yeah. And I mean, focusing on like solutions and shifting towards, what does the future look like? We know that there is not one solution that's going to fix everything. However, I still think that there are some ways that caregivers, you've mentioned the education system and other organizations can provide better support in their everyday lives. And I'm really curious to know, what would your take be on if you had advice to give to those particular stakeholders?
Yeah, I think listening to your patients, listening to community is key. We have an organization here in Cincinnati, Cradle Cincinnati, and they launched Queen's Village several years ago, and the work that they have been able to do by just listening to Black women is phenomenal. So I think that that is the number one thing we can do. What they did is ask women and gender expansive people, what is it that you want to see? What do you need in your healthcare environment? Who is asking us those questions? I think asking your patients that and listening to what they say and being willing to learn. It takes some humbling of our healthcare system to say, hey, we don't have all the answers. I know what I was taught in school. I know what I know, from, wherever, but I need to listen to my patients and trust that they know how they need to receive care. And so once we start to trust them and listen to them and bring them into the decision-making processes, to me, that is when we'll get the kind of care that we all deserve. When it's a real, mutually beneficial relationship, and I'm seen as a partner in my health and an expert on my own body, and then brought in to talk and work with my provider or with the healthcare system to come up with solutions that really will impact me. So I think that's the biggest thing. That's what I would love to see, is just more of us involved in every aspect of care.
Yeah, absolutely. And shout out to Dr. Meredith Shockley and her team, Jocelyn and Danielle. They've been doing phenomenal work that has actually been recognized nationally, even at the White House. And so, speaking of policy and legislation, play a huge role in shaping access and equity. What changes do we need to see at the systematic level to create real, lasting impact for girls?
So I'm going to talk about it here in Ohio specifically, because there are some really major issues when it comes to healthcare providing in the reproductive space. So I work for Planned Parenthood, and we are an abortion provider. In Ohio, we have seen how in the last 40 years, we went from having over 50 abortion providers in the state of Ohio to only, I believe there are 8 or 9 now. So they have dwindled down. And the reason that they've been able to dwindle down is because of legislation that's been passed that's made it really difficult to practice that type of medicine here in Ohio. That same legislation is also regulating or preventing us from providing the sexual education, sexual health education, and reproductive health education that we need to provide to folks. So we can't get into schools. We can't partner with community organizations who receive state funding. So it makes it really difficult when you have an organization who is able to provide that care or provide that information and is an expert at providing that care. They're kind of siloed and unable to partner or to share those services and that information with other organizations. And so we talked about Cradle Cincinnati. I would love to work with them. I think they are doing outstanding work. And I think that there's a lot of potential for crossover between our work. But the state of Ohio regulates that and prevents us from partnering because organizations like Cradle are not allowed to receive funding from the state and partner with an abortion provider. And so when you talk about the systemic issues, so they have looking at Cradle specifically, they have this huge network of Black women who they would love to provide sex education to, but they can't because the number one provider of sex ed in Ohio is restricted from partnering or working with them. And so that creates a gap. And so who do you go to? If there's no one else who's doing that work, and there really isn't a huge provider in Ohio who's doing that, we have to create it from scratch. So you can kind of see again that that's a systematic issue that, it seems like it's one regulation that might stop one particular organization, but it has huge ramifications on all of Black women in Ohio and the ability for us to access that care. So that's That's a huge issue. And I don't know if I answered the question. I feel like I missed a piece of it.
No, you actually answered it perfectly. I really do think, based on the current political climate and kind of just the restrictions that you brought forth, we know that this work can be difficult. However, there are individuals within the community that are interested and want to have access to this level of information and care. However, how do you do it? And so, what are some examples or programs that are working that you may know of, or potential partnerships that are working with Planned Parenthood or beyond Planned Parenthood?
Well, so I will say again, we unfortunately don't have a lot of partners because folks aren't able to work with us. I am working really hard right now to kind of to combat that and to look for opportunities for collaboration. But some really good examples that I've seen are I mentioned Cradle. They're doing really great work. I think another organization that's doing some really good work are some collaborations that I see are between funders and the way that funders, especially here in Cincinnati, have been getting together to support working collaboratively to support initiatives around infant mortality or maternal health that are looking for ways to be able to fund the work that's non-traditional. So a lot of folks who are applying for care and who are doing the care, when we talk about listening to Black women, there are Black women who are like, you know what, I want to be a doula. So I'm going to start a program to become a doula. And maybe they don't have a huge nonprofit that they start, but they still need access to resources. And so these funders are coming together to come up with non-traditional ways to provide them with the funds that they need and the education and information that they need to be able to access that funding, because that can be a whole different barrier, just knowing how to write a grant in a way that will get the attention of a funder. So I think that's something that's non-traditional that's working. Some other programs and partnerships that I see, there is an organization in Columbus, the Ohio Women's Alliance, and they are doing really great work in the advocacy space and in the kind of the community organizing space, working with women, Black women, and giving them the resources that they need to be able to kind of grow in this reproductive healthcare space. So they are, whether it's funding, whether it's, technical assistance like training, they're doing that. Then they're also doing the advocacy piece where they're going up and they are working to make sure that the policies that we have are representative of us. And one thing about them that I really love is their executive director is a Black woman, and a lot of their staff are Black women. And she decided that they are going to take a retreat every year. So she took her team to Costa Rica for a wellness retreat, because she said the work that we do is really difficult, and I want to invest in my team to make sure that they're good, so that they can then come back and do the work that they need. And I think that's where we see Black women. We are going to make sure that we are okay. We have to make sure that we're okay. And so when she told me that she did that, I'm like, wow. Only Black women would do something like that. And I love it. And making sure that your team is okay and taking them on a trip to just relax. I think that that's amazing. So those are the kinds of things that are outside of the traditional scope or traditional ways of doing things that I see people doing. And I think, that's what we need more of.
Absolutely. Absolutely. I think despite how challenging this work is, there is still hope for the future. Mm-hmm. And so, despite all of the challenges that we've talked about today, what gives you hope for the future of Black girlhood?
Well, I think one big area of hope for me is my daughter. So I have a daughter who is 20 now. And she's a junior in college. at Earlham College. Shout out. And her and her friends, I just am so impressed by them. They are really they know about what they want. They know their bodies. They know about their health. They are speaking out and advocating for themselves. And I think that that's great, especially because of the society that I talked about, where they have less rights than I did when I was their age. And so, the fact that they're knowledgeable and that they're out there and they're talking about things that maybe I wouldn't have talked about when I was their age. I think that's great. I also think spaces like this, and the work that you're doing, Ashley, that gives me hope, because it is shining a light on Black girls and Black women who are doing work to support Black girls, and we don't always get that opportunity to shine. And so I think that the fact that you're doing this is wonderful. And I'm so, I'm just so thankful for you for creating this space. So I think those are the kinds of things that give me hope. And Black women give me hope, because, we have been out here saving the world. And I think now we're at the place where we're like, we're not saving the world anymore. We're going to save ourselves. And so I love to see the ways that we're pouring back into ourselves. And that gives me hope too.
Virtual hugs. I love you, Rashida.
I love you so
sweet. I'll try to get through this without crying, because this work is truly important, and I've worked with kids for a really long time, and a lot of this work I think when you're so deep in it, it's hard to come out and try to tell people like, hey, this work, these resources, these people are out here. And when I started the State of the Black Girlhood, I knew that people cared. We just needed an avenue in order to shed a light and shine a light on the work that everyone does every single day. And I'm just blessed to know so many people that have worked in this space tirelessly and have dedicated their personal and professional careers to this space. And just thank you. And so I'm gonna try to get through this still. So potentially we'll have parents that'll be watching this. We'll have educators watching this, mentors, service providers, and potentially even Black girls themselves. What advice would you give to those looking to advocate and show up for Black girls in their own spaces?
That's a good question. I think connecting with other Black women is the number one thing, and other Black girls, because we need to have each other's back. And I think that for me in my life, those relationships with Black women are the things that are sustaining for me. And I think the other thing is just when you see something, I mean, on the one hand, I want to say, see something, say something. I think that's a saying. Like, if you see something that you think is not right, then just keep talking about it and finding out who the people are who can make, who are decision makers in that space and show up there. But on the other hand, that I say that, I also want to caution us to take care of ourselves, because we so often champion all of these issues and we're out there fighting. And I think it's so important for us to fight, but we also have to remember that that's not sustainable, and we have to pour back into ourselves in the same ways that we're pouring out into society. So yeah, I would say just keep talking, keep connecting with other people, looking for opportunities to whether it's at a school, like going to your kid's school and showing up there, or if you're a girl, getting involved, starting a club at your school, connecting with other people who care in the same way that you do. Just looking for those opportunities and those like-minded people. And then also, I'm going to say it again, taking care of yourself. That's so important.
Yes, take care of the people that take care of other people. It really is. It's really, yeah, it is a challenging and rewarding place to be in. We all oftentimes take our work home with us, and it doesn't just turn off. We work with people, not products, and it's just so important to take care of the people that also take care of other people. So Thank you so much for that. And thank you for just taking the time for you, your role within Planned Parenthood, your role in your daughter's life. And before we close, I just want to open the opportunity for you to just share anything that's on your mind or heart that you want to leave the audience with.
Yeah, I think one of the things that I love most about myself is that I am a Black woman and I was a Black girl at one point. And so I just want to share that out to with you all. I hope that you're feeling that love for being a Black woman, being a Black girl. And if you're not a Black woman or girl, I hope that you're sending love and support and all the positive things to the Black women and girls in your life. But yeah, that's on my mind and on my heart is just sending love to us. And I think we need it in this time that we're in right now. Things are rough. I know I'm looking at the news is stressing me out right now, but spaces like this,
Okay.
people like Ashley, are the things that are giving me hope and making me feel a little good. So, yeah,
Yes, we're going to keep working at it together. And
yes.
for those that are watching, these conversations will not stop here. We're continuing this work through State of the Black Girlhood throughout the month of March. Our next session will be on March 1st, March 5th for our Black Girl Dad panel, and March 29th. If you want to learn more about Planned Parenthood's work and how you can support girls advocating for their health, make sure you follow Planned Parenthood. Thank you again, Rashida. This was such a great conversation.
Yeah, thank you.
Bye, everybody.
Bye.